Good afternoon, Mayor O'Neill, Mayor Pro Tem Middleton, and City Council members. My name is Crystal Harris. I'm the Director for Durham County's Community Intervention and Support Services Department. My department is very new, about a year and a half old. We house Bull City United, My Brother's Keeper, as well as Project Build. And so today I will be providing the annual report for Bull City United. Just as a brief overview, Bull City United was implemented in November.
Yeah, thanks. Sorry, we couldn't hear you.
No problem. Bull City United was implemented in November of 2016. Durham County used the shootings and the gun-related crime data to identify 2 census tracts with the highest incidence of violent crime per 1,000 people. Durham County selected 2 census tracts, which is 1301, which is our Fayetteville Street area, as well as 1400, which is McDougal Terrace, as the initial service areas for Bull City United. In 2021, the city and the county both desired to collaborate and combine resources for the purposes of addressing gun violence and increasing support for Durham youth at a higher risk of violence through Bull City United. So based off of the interlocal agreement between the city and the county, you will see that our original census tracts, as I stated, were the Fayetteville Street area as well as McDougal Terrace. The original staffing at that time was 7 staff. There was 1 program manager, 3 violence interrupters, and 3 outreach workers. Upon the interlocal agreement, it expanded us into a total of 6 census tracts. It added our 1100, which is Main Street area, 1304, which is our Cornwallis apartment complex, 1709, which is the Oxford Manor apartment complex, and then 2300, which is the South Side area. That also expanded our staffing. It gave us 18 new positions, 1 supervisor, 5 outreach workers, and 12 violence interrupters. This is our actual departmental organizational chart. As I stated, our department is new, so I am currently the only administrator in the department. I do have an administrative officer who handles all of our budget information, our finance. We do have a couple of vacant positions that I'm still trying to build out the department, which are a community support manager who will act as our liaison for the city with our 2 interlocal agreements that we have, as well as serving as our gain reduction coordinator who will be taking over the gain reduction steering committee that used to live in the juvenile services department, which is the old CJRC. We are also working to hire a data analyst. That person will help us with our data and our forward-facing dashboard that we are actually creating with our internal IS&T department. The purpose of the dashboard is so that our community can actually see the work that we're doing in real time. So we will use the data from Cure Violence Global, which is the model that Bull City United uses. We insert all of our data into their database, and they will provide that to us, and we will upload that on a monthly basis for everyone to be able to see all of the mediations that's occurring, all of the referrals that we're making for different resources to our participants, as well as our caseload count. We will eventually be able to include our project build numbers, as well as some of the work that My Brother's Keeper will be doing, which we just relaunched last month at our relaunching breakfast. So if you look over at Bull City United section of the org chart, we do currently have 1 program manager, Mr. David Johnson, who was here earlier, but he had to leave to go handle our staffing that we have every day with our team. We currently have his side of the house has 12 staff members, 4 outreach workers, and 8 violence interrupters. We do have a vacant program manager position, and that area has 4 outreach workers and 7 violence interrupters. As of this slideshow, we have hired 4 new contract workers. We hired 2 outreach workers and 2 violence interrupters. So right now we only have 4 vacancies within Bull City United. So we are still trying to fill the vacancies of the expansion that we had, because of course that was a 3-time, it tripled the amount of employees that we had originally. So we're still in the process of filling those vacancies. We did have some staff at one point, but we did have some transition happen a couple of months ago. So we're just bringing on new staff. Our staffing pattern for that, we bring them on as contract workers for 6 months. That's to kind of train them, give them an opportunity to determine if this is the work that they really want to do. It's most of the time when you bring people on, you're trying to see if they're a good fit, but we want to be a good fit for them as well. So we give them the opportunity to actually see the work, do the work, and then make sure that they're comfortable with the work that's happening in the community, and then we post the position for competitive recruitment, and more than likely, they are the ones that we hire to fill those positions. So this is just a brief overview of the model that we use, which is a Cure Violence Global model. For Bull City United, we are here to detect and interrupt basically any potential violent conflicts. We try to prevent retaliations as much as possible by utilizing the mediation process. We identify and treat some of the higher risk individuals in the community, as well as mobilize, and we're trying to change the community norms because we know that gun violence is a public health concern, and so we actually respond to every shooting that happens in our census tracts and target areas. These are just the original 2 census tracts that we started with, which was, again, Fayetteville Street and McDougal Terrace. And these are the expanded census tracts since the City of Durham investments. And this just kind of shows you as a whole where the census tracts are located. As you can see, we do only have one area that's in the northern part of the county, and then most of them are within the downtown area, Southside Durham, as well as McDougal Terrace and Cornwallis. Based on the information that you have before you as far as our person shot, for the fiscal year 22-23, we did have a total of 37 shootings in our combined target areas. Cornwallis had the most with 9 shootings, which we saw a spike in Q1 and Q4. Q1, of course, starts with the latter part of the summer. And then Q4 is kind of at the end of the school year. And what we're seeing is that we're having more younger individuals who are the shooters, as well as who are some of our victims of shooting. We also looked at McDougal Terrace and Main Street area. They had 8 and 7 shootings, respectively. Based on the shootings for this year, Southside only had 2 shootings. And we'll take a look at actually what the homicides look like as well. But this is just a chart to show you by quarter what those persons shot look like. And as I stated, Cornwallis did have the most shootings for last fiscal year. For our homicides, we did have 8 homicides total for the year. The south side of Durham, our target area, had no homicides in the last fiscal year. In the previous fiscal year, 21-22, they only had 1 homicide. So that area is continuing to be a space that we are very proud of the work that's being done. We do recognize that Cornwallis had the majority of the homicides, which is 3. And in the last couple of months, we have seen a increase in the shootings in that area. So we are working hard to bring more staffing into the area, and we actually just got a new unit that we can use as our office in Cornwallis and in Oxford Manor, so that we can have even more of a presence and be able to do more work in those 2 areas. And again, this is just to show you by a quarter what those homicide numbers look like. For our participants, we have averaged about 80 participants for last fiscal year. Our current number is 75. And of those participants, 40% are employed. We have 18% who are in school and 29% who are on probation. For last fiscal year, we did not have any participants who were incarcerated or arrested. We do provide participant events. Per our model, we do participant events every quarter, as well as community events. And those community events could be anywhere from, as we just partnered with the Sheriff's Department with their Stop the Violence. We also had our Safe Summer event that we did in July and August. For 5 Saturdays, we went out into our target areas and provided information about gun violence prevention, what to do around gun safety. We had a lot of our community partners to come out. We had Moms Demand Action. We had Hayti Reborn Justice Movement, as well as some of our Durham Parks and Rec to come out as vendors as a part of resources for those events as well. For our mediations, we did do over 2,700, we did 2,789 mediations in the last year. And mediations basically equate to potential shootings that could have happened. These mediations help them not to happen or not to occur, as well as any potential retaliations or conflicts. Mediations can be as simple as we're talking with someone who is saying, I want to go out and do this to someone because I'm angry, I'm mad, I want to shoot somebody. So our team, just talking with them, even if it's just having coffee and kind of de-escalating the situation, that's a mediation. It could go all the way to an active conflict. If there's two parties that are in conflict with each other, our team is, a lot of times they're called out to help mediate that situation so that we don't have a shooting or a homicide in those target areas.
I'm sorry, did you say 2,709?
2,789.
89.
Yes.
I'm sorry.
So just wanted to share some of the highlights from this past fiscal year. We did host our annual Week of Peace in February, and as I stated, we did our Safe Summer outreach project from July and August, 5 Saturdays that we did. We also developed our partnership with Duke University Hospital Violence Intervention Program. We have 4 of our staff who will be working with Duke. This is a very new program for Duke. I think it started last September, and basically they will be calling on us if it's any of our participants that may come in through the ED, or if it's anyone that has come in either through a gunshot or any type of violent crime injury. They can reach out to our team to help with the process of getting them access to, if they're saying, hey, I want to change my life, I want to not be in this lifestyle anymore. They can call on our team, we can come out, we can help provide case management, and they can become a part of our program as well. So our team was just, we went through the Javi training 2 weeks ago, and we will be attending the Javi conference in Chicago just so we can build upon that partnership. We did acquire 2 new units from Durham Housing Authority so that we can have offices within the Cornwallis area as well as Oxford Manor. And so we are working on getting those upfitted so that our staff can move in and actually have a place to bring people to do resumes, work on applying for jobs, just to come in and have some different programming that will happen in those areas. We also received $250,000 for a research project that we received from former Congressman David Price's office. With those funds, we were able to have a 2-day conference this week on Tuesday. Our pre-conference was our staff development day for the department, where we provided trauma-informed care training, self-care training. We had someone that came to talk about speed of trust with Stephen Covey, as well as branding with the team. We find that we have to continue to provide professional development for our staff. They're frontline, they're out there, boots on the ground. So although they're out there working in the community, it's still, we have to make sure they're equipped with the knowledge that's needed to be able to mediate these situations so that everyone can make it back home safely. Yesterday, we hosted our community safety conference. We actually had a max capacity of 250 people. We had people on the wait list who were wanting to come, but were unable to. But yesterday, we had our Representative Zach Hawkins, we had our sheriff on the panel. We actually had Ryan Smith, who I thank him for being a part of that yesterday as well. And then in the afternoon, we had some of our community partners who were on the panel. And the purpose of yesterday and our 2 convening sessions that we're going to have after this is really to engage our community, to find out what they feel they need to have a safer community, to build that safer community together. And our 2 convening sessions, one will be specific to our youth, to engage them in the conversation because they're the ones that we're seeing are most impacted most recently. And then our next convening session will have a lot of our community-based organizations as well as our residents. Again, I want to hear from them what they need help us to identify the gaps in our services. We will also be partnering with 2 of our local universities to evaluate our models that we're using. The models have been in place for about 7 or 8 years for both of our programs, and we just want to make sure, are we doing the most that we can? How much of an impact are we having on our communities? So that is what the funding that we receive, how we will be utilizing that to ensure that the work that Bull City United and Project Build are doing is helping our community, and making sure that what we can do, we can raise up to a 2.0 so that we can continue to grow with the children are changing, youth are changing, our communities are changing. We have to make sure that we can keep up with those changes. So evaluation is necessary. And that's all that I have for you. Any questions?
Thank you so much. I will look to my left to see if you have any questions.
Thank you, Madam Mayor. Thank you so much for the presentation. It's always great to hear from y'all, and appreciate all the work that you're doing in the community. So one of the challenges of measuring this work, right, is that you can't know what didn't happen. So how do you, what is the best way, do you think, to prove the value of this work to the community?
I think the best thing is to ensure that the data that we're receiving, we receive most of our data from Durham Police Department as far as the shootings go. But for me, I also want to see not only the shootings decreasing, which is what the model says, that's our goal, is to decrease the shootings in Durham. But I feel like we need to be able to see the impact of how are we shifting those that are on our caseloads? How are we getting them from committing crimes to now they are productive citizens in our community? How are we getting them to the resources to get jobs, education, showing that progression and succession? That's how I feel we can show the impact of the programs. Yes, ending the shootings and stopping the shootings is wonderful, it's great, but also how are we impacting people's lives? That's the number one priority for me, is ensuring that we can show how our work within the community is getting someone from cradle to career, which is what our My Brother's Keeper program is based off of. So our whole department, that's what we're trying to work around, is making sure that we can show the succession of the individuals that we're working with.
Thank you so much.
Thank you.
Thank you. And along those same lines, I want to say thank you. This presentation is phenomenal.
Thank you.
And I do think that it's really been formalized in a good way that we can track from this year to next year in a very metric-focused way. I will add, I would like to figure out how we not only document externally, but I want to say that the work is also happening within Bull City United. And so who comes in? I can appreciate that you have vacancies, especially for outreach workers and violence interrupters, because I don't think they should be doing that for 5 to 10 years.
All right.
And so just making sure that there's, I guess, whoever is the liaison, is there a way to document how that progress is also occurring? And then if at all there's partnerships that have been created that we should be supportive of, like Haiti Justice Reborn. Making sure that that's highlighted as well. I mean, there may be plenty of others that we're just not aware of. I just want to make sure that it's not lost.
Right, and that's one thing that I'm actually bringing. So I just started in September in this role, but prior to this, I was assistant director with Durham Social Services, and I was over training and development. And so one thing I will be implementing is tracking our training of our staff and what that looks like to be able to provide those numbers as well. Because if you actually look at, if you ask Cure Violence, they say that someone should only be a violence interrupter for 3 to 5 years, which actually 5 is kind of a longevity part, but they should be looking for something, the next step. And as well as bringing those folks on. Of course, we're going to have vacancies because we can't just have anyone do this job. It's based upon your relationships in the community, where you are in your transition, because we do utilize those that have come from this lifestyle. And so, yes, definitely looking at how we can pour into them as well. And so we're bringing in different types of professional development for them, not only that the county provides, but I ask them, what do you want? What would you like to see, so that I can help develop them to move on from these positions, do the job you need to do, and then progress as well professionally for yourself.
Thank you. Good afternoon. Thank you for this presentation. Real quick, with the slide where it's like develop partnerships with Duke University Hospital Violence Intervention Program, is that part of prescriptions for repair?
It is not a part of prescriptions for repair. It's a separate program that Duke actually has on their own with their emergency department, and they've expanded outside of emergency department to the hospital as a whole. So it's separate from prescriptions for repair.
Thank you for that. This is excellent. I think that, this program's been here for a minute. Obviously, the city's role in it was a little later, and I just really appreciate, I think that there's some really important alignment happening. You have a great partner in Community Safety Department. I think the work that the county's doing to kind of put everything in the same umbrella, and I think it is actually going to deliver better results. And I can see that there's been a lot of intention and thoughtfulness about how to do this work. So I look forward to other reports in the future. And was it 2,789 mediations?
Yes.
That's a lot. I mean, that to Councilmember Johnson's point, we don't know what we don't know, right? But I can assume that there would have been the outcome had those mediations not happened. I think we would have felt some of that in
Exactly.
pretty terrible way.
Yes.
So I appreciate this. I'm a former Montessori teacher, so I get the whole conflict resolution piece. And I can imagine this work is extremely challenging because getting 6-year-old children to deal with their conflict and deal with their emotions in a way that's not harmful is extremely challenging. So I can't even imagine in this context where, the outcome and the violence and the consequence of what could happen is much harder than what small children may be experiencing. So thank you for all of this work. Thank you to everyone that is doing it, and I certainly have a lot of gratitude for it.
Thank you.
Thank you, Madam Mayor, and thank you, colleagues, for the great questions and comments. I was really looking forward to this presentation. I want to thank you for being here and the work that you're doing. There have been many gratifying moments on this council, but one of my most gratifying was when we weighed in with municipal funds to expand the footprint of this, a non-policing root cause. Some would say root cause, and I think Councilmember Johnson really put her finger on the dilemma of root cause interventions. I mean, by definition, they are before something happens, and therefore we're always going to be pressed to say, how did this mentoring program really affect crime? How did guaranteed income really affect crime? So it's kind of a faith proposition in many ways. So that's the thing with root cause initiatives, but they're important and they're valuable and they're necessary. A couple of just real quick granular questions. The 2,789 mediations, how many of those were unique, discrete incidents, and how much of that was repeat conversations with the same people?
So I don't have that data, but I can definitely get that to you.
Do you track? I don't want to give you busy work. Is that tracked?
I would have to go into our database to see if they track it separately, but I can definitely check for you.
Okay, that would be good to know. One of my first exposures to the Cure Violence and this type of initiative, 2015, I was on a junket for the city to Boston, and they were already doing the hospital component then. So I have a question about Duke's hospital, because as I understand the hospital component, victims are actually interviewed and talked to while they're in the hospital. That's
correct.
Those are the most. Is that actually what's happening with Duke, and how many incidents or mediations have we had in that light?
So we have not gone in. We just got trained 2 weeks ago. So we have not gone in, but as of yesterday, we had Uzuri Holder, who is the program manager for Duke's program. She was on our panel yesterday. They have engaged with 175 individuals already. And as I said, they just started their program last September. So we will be working with them to get started, because like I said, we just got trained 2 weeks ago. So we have not engaged yet, but they have had at least 175 individuals they've worked with.
Are all of your interrupters going to get the training on how to go into, or is
No,
it just
we could only identify 4.
Right.
Because of course we're going into the hospital, there's specific training. So we have 3 violence interrupters and 1 outreach worker, and then a supervisor.
Right. Is the funding, that the current funding stream, is Duke putting money up for this, or are they integrating this, or who's paying for it?
So Duke is a Duke program. We just are under a memorandum of understanding or agreement with Duke, so there's no money being exchanged.
Got you.
So it's more of a partnership. They have their program, and then we're just collaborating with them to assist with any potential purchases that we have that are coming into the ED, or if they want to refer someone to our program.
Well, our thanks to Duke for being such a great partner. This is such an important, I mean, every one of the practitioners I've spoken to around the country have talked about how important that moment when they're in a hospital bed is, how susceptible
Yes.
they are at that moment too. So this is beyond exciting to see this partnership. So I'm really grateful for the work you're doing. Please convey our thanks. Everyone with those boots on the ground. It's an important initiative, and my thanks to my colleagues for our continued support.
Thank you.
For it. Thank you. Thank you, Madam Mayor.
Thank you all for your comments. I have enjoyed this presentation. I actually had a couple of questions that I was talking to the city manager yesterday, but I'm fully satisfied with what you've told us today, that you've answered my questions. I can't wait to see what happens over the next 6 months. And we thank you for your leadership and for the team of young people who are behind you, as well as the county.
Thank you so much. We thank you all, and thank you for your continued support.